Dean Street was kind of the birthplace of sexual health for men. The world's first sexual health clinic opened in 1862 at number 91 Dean Street. And actually, if you walk along Dean Street, you can actually still see over the door, there's a little sign saying male hospital. They've tried to scrub it out and it's being redeveloped, but you can still see it there now. And obviously that was Victorian England, and the place was very stigmatised. And it was so stigmatised that to get people to come into it, they had to pass a local bylaw that the police weren't allowed on the street. So of course that did lead to Dean Street becoming kind of quite a vibrant, shall we say, area of London. The hospital was very busy, so here at 56 Dean Street we see about 25,000 people a year. Well, at its peak, the Lock Hospital at 91 was seeing over 60,000 people. So it was hugely busy, and nowadays treatments tend to be kind of quite quick, single doses of treatment. In those days, somebody with syphilis would be brought into hospital and be kept as an inpatient. People having kind of treatments for gonorrhea would come in regularly to have kind of toxic chemicals flushed down their urine pipe. It wasn't quite as simple, and it was a lot more unpleasant, I think, in those days. You can see why people wouldn't want to go. When the kind of Great War, World War I, ended, there was a huge surge of syphilis in the UK. And you've got another peak during World War II. And people always kind of blamed returning soldiers kind of coming back and infecting their wives. But it became a huge public health problem because in those days, a woman with syphilis could have a congenitally malformed baby. We now screen women during pregnancy and treatment, but it was a huge thing. And so to try and address that, the government introduced a law called the Venereal Diseases Act in 1917. And that did two things. One, it set up each health board in each area had to set up a forerunner of a sexual health clinic, which had to provide free treatment, which of course the NHS wasn't going to arrive for another kind of 32 years or 39 years or whatever. So it was massively foreran the NHS. But also it put into law protection of confidentiality, so that anyone using a sexual health clinic was guaranteed that other people could not access information about them without their permission. And those rules in a modified version still exist today. Sexual health clinics were always the kind of Cinderella part of the hospital, and were often kind of buried in the basement. So you can trace back our service to the 1920s, where it was based at the Westminster Hospital. And that clinic, which was called OP6, was in the basement of the hospital. I never worked there, because I'm too young. But the outpatient 6 was where kind of the very first HIV patients were diagnosed in the UK. And you accessed OP6 past the mortuary into a space that had no windows. And so looking back on it now, you can think that's absolutely awful. There was this disease, no one knew what it was, people were dying, and to get to see the doctor, you'd sometimes have to kind of squeeze past the trolley with dead bodies on it, kind of waiting outside the mortuary. So we've come a long way since then. The clinic's moved twice and has slowly found its way above ground. And so this final move we've done recently, I guess we wanted to kind of reflect the changes in attitude. We wanted to completely destigmatise it, make it very accessible, very open, so hence us, and take it to where people need it. Not you have to kind of catch a bus to an industrial estate somewhere. I mean, one of the kind of the scary facts that convinced people to allow us to move here is that there are about 100 gay venues within 500 metres of this spot. And in each bar, on average, 5% of the gay men in each bar have undiagnosed HIV. So we're kind of sitting in the centre of probably kind of the largest concentration of people who have HIV and aren't aware of it, probably anywhere in Western Europe. And it seems the natural place to do it, and then to really target it by making it easy. You get a result within an hour, guaranteed, any time, open in the evening, open on Saturdays. And I guess it's all part of making it responsive to people's needs, rather than perhaps, oh, if you go back to the lock hospital, it was a bit like a punishment, wasn't it? You know, you went in, you had some horrific treatment, and it was so stigmatised, you had to go down some street where even the police wouldn't go. You know, I think times have changed.